Hello everyone. I am myself Dr. Rajesh Gubba. I am the general medicine educator. So in the today's session, I'll be discussing the quiz which I have posted on 6th of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So on this particular Telegram channel, daily I am posting the quiz, and on the subsequent day I am also sending the explanation as well. So as a part of it, let us discuss the first question. All of the following are non-motor features of Parkinson's disease except. So in the today's quiz, almost all the 5 questions are related to Parkinsonism. So which among the following is not the non-motor manifestation of Parkinsonism? Sleep disturbance, cognitive impairment, loss of taste, and loss of smell. So if you take the non-motor manifestations, initially the patients with Parkinsonism, most of the time they present with motor manifestations, and followed by that they also have non-motor manifestation as well. And these non-motor manifestations include sleep disturbance, cognitive impairment, and as well as loss of smell. But whereas loss of taste, it is not the non-motor feature of the Parkinsonism. Now let me just give you the list of all the non-motor features of the Parkinson's disease. Right, so loss of taste, it is not the feature of Parkinson's, whereas the non-motor features include depression, anxiety, cognitive impairment, sleep disturbance, sensory abnormality, loss of smell, and disturbed autonomic system. This will be the non-motor manifestations in patients with the Parkinsonism. All right, now take the second question. The commonest type of Parkinsonism with known etiology is head injury, familial, idiopathic, sporadic. So if you take almost 85 to 90% of etiology for Parkinsonism, the etiology, it is like unknown. What we call it as is the sporadic. Most Parkinson's disease cases, they occur sporadically. Almost 85 to 90% of cases, right, they are sporadic and of unknown cause. So the commonest type of Parkinsonism with known etiology is sporadic. Then next question, Parkinsonism may be caused by all except reserpine, alpha-methyl-dopa, metoclopramide, then phenytoin sodium. The correct answer here is the phenytoin sodium, which is an anti-epileptic. This will not cause the Parkinsonism. Whereas you take the other conditions which will cause the Parkinsonism. We have the infectious pathologies which are responsible for secondary Parkinsonism. That includes the post-encephalitic, then acquired immunodeficiency syndrome, the one which is caused by the HIV. Next we have subacute sclerosing panencephalitis, right, which is caused by the measles virus, right, which is caused by measles virus. Then Creutzfeldt-Jakob disease, this is a prion disease, right, which is a human prion disease. So these are the infectious pathologies that can cause secondary Parkinsonism. Apart from that, we also have some drugs which will cause Parkinsonism. The mechanism of these drugs that will cause Parkinsonism is, these drugs, either they are dopamine receptor blockers, or these are the group of drugs which will decrease the levels of the dopamine. So what are those drugs? The dopamine receptor blocking agents include the antipsychotics and as well as antiemetics. The other drugs are reserpine, tetrabenazine, alpha-methyl-dopa, and as well as lithium. So the drugs causing Parkinsonism is a very, very important area for the questions as well. Now, then we also have some toxins causing Parkinsonism. See, what these toxins they do is they damage the dopaminergic neurons within the brain, right? And these dopaminergic neurons, they are present within the basal ganglia, right? The examples are the MPTP, then carbon monoxide, manganese, mercury, carbon disulfide, cyanide, and as well as the methanol. So these toxins, what they do is they damage the dopaminergic neurons within the brain. And not only that, these particular toxins, they also cause the oxidative stress, right? And they also cause mitochondrial dysfunction. And third important thing, they also cause the inflammation. So these are the toxins that will be causing the secondary Parkinsonism. Followed by that, we have certain cases of trauma that are also responsible for secondary Parkinsonism, that is pugilistic encephalopathy. And we have parathyroid disorders, that is, so pugilistic encephalopathy, it is nothing but the repeated head trauma, right, repeated head trauma. Okay, then you take the parathyroid disorders. The parathyroid disorders, that includes the hyperparathyroidism and as well as the hypoparathyroidism. So both of these can cause the Parkinsonism. So hyperparathyroidism, what it does is it will increase the calcium levels, and this calcium will go and deposit within the basal ganglia, causing secondary Parkinsonism. Hypoparathyroidism, there will be hyperphosphatemia. This phosphate will combine with whatever is the available calcium. That calcium phosphate is formed, and that will go and deposit within the basal ganglia, causing Parkinsonism. Then hepatocerebral degeneration. See, basically in hepatocerebral degeneration, there is hepatic dysfunction. Because of hepatic dysfunction, there will be increase in the levels of the ammonia and as well as the another important substance, that is manganese. So this ammonia and as well as manganese, both of them, they are very much toxic to the brain, right? They are very much toxic to the cerebral neurons, particularly the basal ganglia, and that will cause decrease in dopamine levels, causing what is called as Parkinsonism. And not only that, in case of the hepatocerebral degeneration, there will be also reduced gamma amino butyric acid activity. So there will be also decreased GABA activity, which can also contribute to the development of Parkinsonism. So we have pugilistic encephalopathy, that is head trauma. The others like the parathyroid disorders, hepatocerebral degeneration, brain tumor, and as well as the paraneoplastic conditions. So remember, these are all the secondary causes for the Parkinsonism. So we have all the way from infections, then drugs, then toxins, then your trauma, then followed by some other endocrine conditions and others. Next question. Parkinsonism symptoms develop when striatal dopamine depletion reaches how much of the normal? The options are 10 to 30%, 30 to 50%, 50 to 70%, 70 to 90%. So when the striatal dopamine depletion reaches 50 to 70%, that is the point when the individual will develop Parkinsonism, right? Now, the next important question is, testing for postural instability in Parkinsonism is done by swing test, push test, pull test, then lift test. So the answer here is the pull test. Now what exactly is the pull test? Pull test is the one which helps in assessing the postural instability. So what we need to ask the individual is, like the examiner, he stands behind the patient, okay, and the patient, he gives a backward push on the examiner hands, and examiner should be able to hold the backward push of the patient. Now suddenly the examiner will release the hands, right? When suddenly the examiner releases the hand, what happens? Because the patient is giving a backward push, there will be backward movement of the patient whenever the examiner releases the hand. Now, when will you consider it as normal? When will you consider it as Parkinsonism? Let me tell you. So whenever the examiner has released the backward push, when do you call it as normal, right? The patient recovers with 1 or 2 steps back. That is considered to be normal postural stability. But if the individual is very unstable, right, and he tends to lose the balance spontaneously or with just a gentle pull on the shoulders, then we consider it as the severe form of Parkinsonism. So even though the patient takes almost 3 to 5 steps back, then also the patient is said to be having the Parkinsonism, okay? So in a normal individual, like what happens when the examiner releases, the patient will immediately recover within 1 or 2 steps back. That is said to be normal postural stability. But after the release, if there are several steps back taken by the patient, or if even falls, then we consider it as postural instability, which is suggestive of Parkinsonism. So remember, now the test which is useful for assessment of the postural instability in Parkinsonism is the pull test. So these are the 5 questions which I have posted on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba, on 6th of May. So thank you very much. See you in the next session.